We have also invited House Minority Leader John Boehner to discuss the new health care bill. So what does the new law mean to you? We continue our series tonight with the changes it will bring to Medicare coverage. Julie Robner, who covers health care for National Public Radio, joins us to help explain. Welcome, Julie. Welcome back.
Thanks.
Let's start by talking about prescription drug coverage. Obviously, there was a problem they were trying to fix. What was that?
This is sort of some unfinished business from the last big health care bill, the 2003 Medicare prescription drug law. This is called the donut hole. It's a gap in coverage for most people after you spend a little over $2,000 on prescription drugs. There is no coverage until you get up over $6,000. So people have to continue to pay premiums, but they have to pay for all of their own drugs until they get to that catastrophic benefit, and that is really frustrating for the 3.5 million or so seniors who fall into that donut hole every year. So there's been a lot of anxiety about that and a desire, particularly by Democrats, to try to close that donut hole, although it's expensive.
So there are two kinds of fixes which exist in this law. I keep calling it a bill, but it's a law now. What is the short-term fix?
Well, actually, the short-term fix is in the reconciliation bill that's still being debated in the Senate, but one presumes that will pass. And the short-term fix is a $250 rebate for everyone who falls into the donut hole starting this year in 2010. And then there will be a beginning of the closing of that donut hole. Next year, for example, there'll be seniors will get a 50% discount on their brand-name drugs. And then slowly over time, by the year 2020, the benefit will be the same within the donut hole as it is for that first couple of $1,000s of drugs. There will be a 25% copay. Now, I should point out that not every drug plan operates the same way. They don't all have the 25% copay on that first couple of $1,000s, so it may differ. But the fact that the donut hole is being closed means that everyone who buys one of these prescription drug plans will get more benefits, and there won't be a donut hole for them. So it may not work exactly the same way.
Not immediately, certainly eventually.
Yes.
So what do Medicare recipients, people who get Medicare now, lose? Do they lose any of their traditional benefits?
No, there will be no one who will lose any traditional benefits. There may be some people who may lose some extra benefits, but no, there is no cutback on any of the guaranteed Medicare benefits in this law.
But there is something called Medicare Advantage, which many recipients have taken to treat as part of their traditional benefit. Explain what that is.
This is also left over from that same 2003 Medicare prescription drug law. The Republicans who passed that law with mostly, although not exclusively Republican support, wanted to move more people into private drug coverage that would compete with government drug coverage. And so there were already private plans serving Medicare patients, but they wanted there to be more plans. So they began to overpay those plans, basically give them more money. Now it's about 14% more than the government spends to take care of Medicare patients, in hopes that more people would sign up for those plans. And that's exactly what happened. A lot more people signed up for those plans. And they get extra benefits with that extra money. They get vision care and hearing care and foot care. It is, well, of course it's expensive, and it's coming out of the taxpayers' pocket, because it's that extra money.
So does that go away now?
The extra benefit, the extra money goes away, and with it probably the extra benefits.
People want to also know who pays for all of this and how. So let's talk about taxes. Do taxes go up?
Taxes go up for people who pay for Medicare, not necessarily for Medicare recipients. Everyone now pays the 1.45% payroll tax, and that does not stop. Unlike Social Security, you continue to pay that on all of your income. For high-income people who earn over $200,000, if they're individuals, or $250,000 for couples, that tax will go up to 3.8%. There will also be a new tax on unearned income, again, but only for those high-income individuals. So if you make less than $200,000 as an individual, less than $250,000 as a couple, there will be no new taxes for Medicare.
But if you make more than that, if you fall into that high earning category and you spend, when you say unearned income, you mean investment income.
That's correct.
Then you start to pay higher taxes to pay
correct.
for part of this. Okay, well, explain some of the other benefits. There's supposed to be physician reimbursements, which are increased. Does that really happen in this law?
No, it does not. That's one of the big things. Now, there's sort of short-term changes and long-term changes. And, short-term, there are some cuts to some reimbursement for providers. They've basically agreed to these cuts because they want to see, they know that they're going to get more people insured, so they'll see that money back. In the long term, there are changes to the way health care is delivered. Not as many as some people would like to see, but there are some. The one thing that's not in here, though, is that there's this scheduled 21% cut to doctors. This has been a lingering problem really over the past decade. It is
heard
not
John
addressed.
McCain talking about it on the floor today.
That's right. And that is not addressed in this bill. It was originally addressed in the House bill. Everyone knows Congress has to take care of it, and they're going to have to pay for it, and that's not in this bill.
21% cut to doctors. What do you mean by that?
That would be an actual cut to what doctors get paid to take care of Medicare patients. It's a formula flaw. It's going to have to be fixed. It's not in this, and it needs to be addressed. And that's something that needs to be addressed really aside from what's being done in this law to address the Medicare issue.
There's also something in this law called wellness benefits, which I assume means regular checkups. What does it mean?
Yes, there will be no co-payments or deductibles for preventive care. That is a new benefit for Medicare. There will be annual physicals for Medicare patients, so that's another new benefit for Medicare patients.
So right now, a Medicare patient could get a physical paid for one time.
That's right.
But now an
when
annual mammogram, cancer screenings, are those included?
Those are. Well, those have always been Medicare covered benefits. You won't have to pay anything, though. You used to have to have either meet your deductible or have a co-payment. Those will now be free and covered by Medicare. Plus, you'll have an annual checkup.
Is there any way to know on balance whether most Medicare recipients gain or lose from these changes?
Well, there's certainly anybody who falls into the donut hole and has prescription drug benefits will gain from this, and certainly those who avail themselves of the preventive care will benefit from this, and certainly the people who, there have been lots of complaints about the cuts to providers, with the exception of the doctor issue, which will be dealt with separately. Most of the provider cuts probably will not affect most of the beneficiaries unless they're in those Medicare Advantage plans and seeing those extra benefits go away.
And they're definitely the ones who lose out. Julie Robner, thanks so much.
You're welcome.